Federal Case File 9015 HHS, declassified. The events on record begin in the spring of 2019 in the Medicare Data Analysis Division of the Office of Inspector General, Department of Health and Human Services, Washington, D.C. The analyst's name was Sandra Okafor. Her title was Senior Data Scientist, Fraud Detection Branch, HHS-OIG. She was not a field agent. She did not carry a badge. She worked in a corner office on the 4th floor of a federal building on Independence Avenue, and her primary instrument was a monitor loaded with 8 years of Medicare Part A claims data. On the morning of April 3, 2019, she was running what the office called a survival curve audit, a statistical tool designed to identify hospice providers whose patient populations outlived their terminal prognosis at statistically improbable rates. The logic behind the audit was simple. If a hospice provider is correctly enrolling patients with 6 months or fewer to live, the curve of those patients' remaining lifespans should follow a predictable actuarial pattern. Patients should die, the curve should descend. What Okafor found instead was a cluster of 17 hospice facilities, all operating under a single corporate umbrella, whose enrolled patients were not dying on any recognizable schedule. The facilities bore the names Serenity Hospice and Care, LLC. They operated across 6 states, Texas, Louisiana, Arkansas, Mississippi, Tennessee, and Georgia. And the data showed that as of March 2019, Serenity had enrolled 2,847 active patients under hospice status, patients for whom Medicare was paying daily rates averaging $185 per person, while the statistical mortality rate for that population over the preceding 36 months was approximately 40% lower than actuarial models predicted for a genuinely terminal group. The file notes Okafor's handwritten annotation in the margin of her printed output. These patients are not dying at the expected rate. Either the prognosis documentation is fraudulent or the patients were not terminal at enrollment. She flagged the file and sent it upstairs. The referral landed on the desk of Special Agent in Charge Martin Holloway, Criminal Investigations Division, HHS-OIG Dallas Field Office, on April 14, 2019. Holloway had 22 years in federal healthcare fraud investigation. He had worked pharmaceutical kickback cases, durable medical equipment fraud, and 2 prior hospice billing schemes, smaller operations, regional. What Okafor had sent him was different in scale. He requested a preliminary inquiry authorization and received it on April 22nd. The case file was designated HHS-OIG Case Reference 19 CF0714HF. Cooperating agencies were added within 60 days, the Federal Bureau of Investigation, Dallas Field Division, the Internal Revenue Service Criminal Investigation Unit, Austin Field Office, and the Department of Justice Civil Fraud Section, Washington. The first question investigators needed to answer was structural. Who owned Serenity Hospice and Care, LLC? On paper, the company was incorporated in Delaware in 2011. Its registered agent was a law firm in Wilmington. Its stated officers were a pair of names, Raymond Voss, listed as Chief Executive Officer, and Carla Duprat-Fontaine, listed as Chief Operating Officer, with addresses corresponding to a shared executive suite in Houston, Texas. The company had filed as a Medicare provider with the Centers for Medicare and Medicaid Services since 2012, and in calendar year 2018 alone, it had submitted and received reimbursement on Medicare claims totaling $312,847,000. $312,847,000 in a single year. Investigators pulled 7 years of Medicare claims data for all 17 Serenity facilities. The total, from 2012 through early 2019, came to $847 million. $847 million in Medicare reimbursements paid out across 7 years to a hospice chain whose patients, per the data Sandra Okafor had surfaced, were not dying at rates consistent with terminal diagnosis. The affidavit filed in support of the initial court-authorized subpoenas describes this as a systemic and sustained scheme to defraud the Medicare program by enrolling patients who did not qualify for hospice benefits, generating fraudulent certifications of terminal illness, and billing Medicare for end-of-life care services that were medically unnecessary or never rendered. The mechanics of the scheme, as reconstructed from the seized records, were methodical. Serenity employed a network of recruiters, referred to internally as patient liaisons, operating out of each of the 17 facilities. Their job was to identify individuals in assisted living facilities, nursing homes and senior communities, not patients who were dying, but patients who were elderly, isolated and unlikely to scrutinize their own Medicare statements. These individuals were targeted specifically because their age and baseline health conditions could plausibly support a terminal diagnosis on paper, even when no such diagnosis was clinically warranted. The patient liaisons operated on a commission structure. The seized ledger records Exhibit 14C in the case file show payments ranging from $400 to $1,200 per enrolled patient, paid in cash or through gift card distributions. A portion of those payments were routed through a company called Lone Star Patient Referral Services, LLC, which was later identified as a shell entity controlled by Raymond Voss. Once a patient was identified, the liaison referred the file to a physician in Serenity Path's contractor network. The case file identifies 31 physicians across the 6 states who participated in the scheme. Their role was to sign Medicare certification forms, Form CMS 485 and related documentation, attesting that the patient had a terminal prognosis with a life expectancy of 6 months or fewer. The physicians received between $300 and $800 per certification, again paid through intermediary channels. Exhibit 22F. The testimony of cooperating physician Dr. Marcus Leyland of Shreveport, Louisiana, reads in part, "I was given a list of patients. I was told what to put on the forms. In the majority of cases I reviewed, I had never seen the patient in person. In some cases I reviewed the records for perhaps 2 or 3 minutes. I knew the documentation was not clinically supported. Once certified, the patients were formally enrolled in hospice care." Medicare's hospice benefit is a per-diem payment system. The program pays a flat daily rate for each enrolled patient, covering nursing visits, medication management, aid services, and other end-of-life care. Serenity Path billed for all of it. The nurses and aides assigned to patients often made cursory check-in visits, or in some documented cases, made no visits at all, while billing for full service hours. The per-diem billing continued, month after month, for patients who were not terminally ill and therefore did not decline on any clinical schedule. Medicare has a provision called a live discharge. When a patient improves beyond hospice eligibility thresholds, they are to be discharged from hospice status and Medicare billing halted. Serenity Path's internal records show that patients approaching the benchmark that would trigger a live discharge review were instead recertified, their paperwork updated with language indicating continued terminal decline, allowing the billing to continue uninterrupted. The Wiretap logs, authorized under Title III in August 2020, captured Raymond Voss in a phone conversation with a regional director. "If the chart doesn't support 6 months, fix the chart. We've got too much per diem on the line to lose another batch." The entry for that call is logged in the Wiretap manifest as call reference WT714-0083, recorded September 4, 2020, duration 4 minutes and 12 seconds. The money, once received from Medicare, was not sitting idle. The IRS-CI component of the investigation traced the flow of reimbursement funds through Serenity Path's corporate accounts and into a web of affiliated entities. The primary instrument was a company called Meridian Healthcare Properties, LLC, also controlled by Voss, which received management fee payments from Serenity Path totaling $41 million across 4 years. Those fees, investigators determined, were fictitious. Meridian performed no actual management services. A secondary entity, Gulf Coast Medical Consulting Group, received $18 million in consulting fees, again fictitious. The money moved outward from there, into real estate purchases, including 3 residential properties in the Houston metropolitan area, 2 commercial buildings in Shreveport, and a waterfront property in Port Aransas, Texas, all acquired in the names of nominee LLC entities with indirect ties to Voss and Dupree Fontaine. Interpersonal expenditures, a 52-foot vessel registered in Corpus Christi, automobiles, jewelry purchases, wire transfers to accounts in the Cayman Islands. The IRS-CI affidavit, filed March 2021, identifies the Cayman transfers as totaling $22,400,000, routed through a bank in Houston to an intermediary account in the British Virgin Islands before landing in a private banking account at a financial institution in Georgetown. The investigation ran for 31 months. During that period, investigators maintained parallel surveillance streams, financial surveillance through subpoena records and pen registers on corporate accounts, communication surveillance through the Title III wiretaps authorized in August 2020, and on-the-ground case building through interviews with 17 cooperating witnesses, including 4 former Serenity Path employees, 2 participating physicians, and 9 patients or patient family members. The patient testimony was, by the case file's own notation, among the most significant evidence compiled. One patient, a 79-year-old woman residing at an assisted living facility in Baton Rouge, Louisiana, had been enrolled in Serenity Path hospice care for 22 consecutive months. She was not aware she was enrolled. Her family had not been informed. She remained ambulatory, cognitively intact, attending group meals at her facility, while Serenity Path was billing Medicare for end-of-life nursing care and medication management in her name. Her file was among 341 similar cases identified during the investigation. The case file notes, the patients enrolled in this scheme suffered no direct physical harm in most documented instances. The harm to those individuals was the fraudulent appropriation of their Medicare identity and the depletion of their Medicare benefit entitlement. The harm to the program and the public treasury was direct, quantified, and severe. By early 2021, the investigative team had assembled what the lead prosecutor, Assistant United States Attorney Denise Tremblay of the Southern District of Texas, described in her notes as a fully mapped enterprise. They had the corporate structure, the bank records, the wiretap transcripts, the physician certifications, the patient liaisons commission ledgers, the Cayman wire records, and the cooperating witness testimony. The question was sequencing the takedown. The decision was made to execute simultaneously across all 17 facility locations to prevent document destruction and flight risk by lower-level participants who might receive word of arrests at one site before agents arrived at others. The operation was designated Task Force Authorization 21TF0092. Coordinating agencies: HHS-OIG Criminal Investigations, FBI Dallas, IRS CI Austin, the Drug Enforcement Administration's Financial Crimes Unit, and the U.S. Marshals Service. Execution date: October 14, 2021. At 6 a.m. Central Time on October 14, 2021, federal agents moved on 17 locations across 6 states. At Serenity Path's corporate headquarters in Houston's Greenway Plaza district, Special Agent Holloway led a 12-agent entry team through the glass lobby of the third-floor suite. The building's property management had been briefed the prior evening under seal. By 6:04 a.m., agents were at the receptionist's desk. By 6:09, the server room had been secured and forensic specialists were beginning the mirror imaging of the company's electronic record systems. At the Serenity Path facility in Shreveport, Louisiana, 6 agents executed a simultaneous search warrant. In Memphis, Tennessee, 4 agents entered the Regional Administrative Office. In Jackson, Mississippi, Little Rock, Arkansas, and Beaumont, Texas, coordinated teams entered remaining facilities within the same 40-minute window. Raymond Voss was arrested at his residence in the Memorial area of Houston at 6:17 a.m. Agents from the FBI Dallas Division, accompanied by 2 U.S. Marshals, made contact at the front door of a 400-square-foot home in a gated community. The arrest was without incident. Voss was transported to the Federal Detention Center downtown. Carla Dupree Fontaine was arrested at Houston's William P. Hobby Airport at 6:31 a.m. She had arrived at the terminal with a carry-on bag and a one-way ticket to Cancun, Mexico. Departing at 8:10 a.m., agents from the FBI and U.S. Marshals made the arrest at the security checkpoint. The case file notes that her checked luggage contained personal documents including a second passport, obtained under a variation of her name, issued by a Dominica Citizenship by Investment program. 11 additional individuals were arrested that morning across the 6 states, 6 facility administrators, 3 patient liaisons, and 2 participating physicians. Marcus Leland, the cooperating physician in Shreveport, was not among those arrested. He had entered into a cooperation agreement with federal prosecutors 14 months prior. 27 arrest warrants had been issued in total. 16 were executed on October 14th. The remaining 11 were served over the following 11 days as agents located individuals at secondary addresses, hotels, or through commercial airline records. The final arrest in the case was made on October 25, 2021, when a regional director named Philip Ardoin was taken into custody at a relative's home in Opelousas, Louisiana. The physical evidence seized across the 17 search sites filled, per the evidence log, Exhibit 1A through 1F of the case file, 2 shipping containers of paper documents, including patient certification files, commission ledger books, and internal memoranda, 31 computers and servers, 14 external hard drives, 22 mobile phones, and, at the Houston headquarters, 2 filing cabinets that had been recently emptied. Their contents, investigators later determined, had been shredded on the evening of October 13th. The shredding, however, had been incomplete. Forensic specialists recovered partial fragments of 17 documents, including a ledger page listing physician certification payments by name and date. The indictment, returned by a federal grand jury in the Southern District of Texas on October 7, 2021, 1 week before the raid, under seal, charged Voss and Dupree-Fontaine with conspiracy to commit healthcare fraud, substantive healthcare fraud on 412 individual counts, conspiracy to commit money laundering, substantive money laundering, and conspiracy to pay and receive healthcare kickbacks under the anti-kickback statute. The total fraud alleged in the indictment was $847 million. The physicians and administrators faced staggered charges. The 31 physicians who certified patients were charged under separate informations with receiving illegal kickbacks and making false statements to the Medicare program. Facility administrators faced conspiracy and substantive fraud charges corresponding to their specific locations. Trial proceedings began in the Southern District of Texas on March 9, 2023. The trial lasted 19 days. The government presented 124 witnesses, 3,817 exhibits, and the testimony of Sandra Okafor, the HHS-OIG data analyst who had first noticed the survival curve anomaly in the spring of 2019. Her testimony walked the jury through the statistical analysis that opened the case. The method by which a pattern in data read correctly had exposed a scheme that had continued undetected for 7 years. On April 4, 2023, the jury returned guilty verdicts on all counts against Raymond Voss and Carla Dupree-Fontaine. Sentencing was held on September 19, 2023. Raymond Voss received 27 years in federal prison. The sentencing memorandum cited his role as the architect of the scheme, his obstruction of justice through the partial destruction of records, his possession of the fraudulent Dominica passport issued in Dupree-Fontaine's name, which investigators determined Voss had arranged to facilitate potential flight, and the scale of the fraud, $847 million taken from a program designed to serve the genuinely dying. Carla Dupree-Fontaine received 19 years. Her sentence reflected her secondary operational role and her attempt to flee on the morning of the arrests. Of the 31 physicians charged, 28 entered guilty pleas. Their sentences ranged from 2 to 7 years in federal prison. 3 physicians proceeded to trial, 2 were convicted, 1 acquitted. In addition to criminal sentences, the physicians faced civil exclusion proceedings under the Social Security Act. 27 were permanently excluded from participation in Medicare and Medicaid programs. The 6 facility administrators who went to trial received sentences between 4 and 11 years. Patient liaisons received sentences ranging from 18 months to 4 years. Civil forfeiture proceedings ran parallel to the criminal case. The government seized $22,400,000 in the Cayman Island accounts, 6 real estate properties with a combined assessed value of $11,300,000, the 52-foot vessel in Corpus Christi, and 42 vehicles. Raymond Voss and Carla Dupree-Fontaine were ordered jointly to pay $847 million in restitution to the Medicare program. The case file closes with a section designated Narrative Summary, Systemic Impact. It reads, in part, the Serenity Path investigation demonstrated the vulnerability of the Medicare hospice benefit to systematic exploitation. The benefit was designed as a compassionate provision for patients at the end of life and for their families. It functions on the presumption of honest certification, where that presumption is deliberately defeated, where certifying physicians sign documents they know to be false, where corporate administrators build financial incentive structures around fraudulent enrollment, where the dying are impersonated on paper by the living. The benefit becomes a mechanism of extraction rather than care. It continues, The scheme operated for approximately 7 years before the data anomaly surfaced in a routine statistical audit. The investigative record does not indicate that any patient was physically harmed. It does indicate that 341 patients were enrolled without their knowledge or informed consent. Their Medicare benefit entitlements, which are lifetime limited under federal statute, were drawn down during the enrollment period. For some of those patients, the depletion of their hospice benefit meant that when they did eventually require end-of-life care, when they were genuinely dying, their entitlement had been reduced or exhausted. The case file was declassified on February 28, 2025, following the completion of all appellate proceedings. The Court of Appeals for the Fifth Circuit affirmed the convictions of Voss and Dupree-Fontaine on January 14, 2025. All other convictions in the case had been finalized prior to that date. Federal Case File 9015 HHS closed.